Health officials in China say around 14% of patients who had the coronavirus but recovered in the southern Guangdong province have tested positive for the virus again, and the same phenomena has been reported in Japan. Officials in both countries have said they're still learning about this new virus. In China, the number of infected continues to rise, with 433 new cases reported on Wednesday, all but 24 of those located in Hubei, where it all began. Numbers in South Korea continually bouncing up, and the total number has now reached more than 1,700. And in the past hour or so, we've heard from Japan's Prime Minister Shinzo Abe. He has announced that public schools will be closed from next Monday until the end of March. So let's take you live to Tokyo and join our correspondent there, Jenny Hill. That is quite an announcement from Shinzo Abe, Jenny. It really is going to affect daily life in Japan.
Yes, and I think it gives you an indication of just how concerned the authorities here are about the situation. They're also very concerned, of course, to be seen to be on top of the situation, because they've already come under a great deal of criticism over their handling of passengers who became infected on the Diamond Princess cruise ship, which is moored up still just down the coast in the port of Yokohama. The number of cases in Japan is rising. Now, the vast majority, some 700 of them, originated on board the cruise ship, but what's concerning the authorities is the fact that separate cases are now emerging in clusters all over the country, in particular centred in the northern region of Hokkaido. But in addition to that, the authorities now are really troubled by this one particular case, a woman in her 40s who was treated for the virus, discharged from hospital at the start of February, but now it's emerged she's tested positive for the virus again. That will be of concern not just here in Tokyo, but to health experts, of course, all over the world. And the big headache for the Japanese authorities is that in just 5 months' time, Tokyo is due to host the 2020 Olympics. There are banners everywhere saying Tokyo 2020. The authorities insist that their plans, their preparations will continue as normal. But we have heard today from Tokyo's organising committee, its chief executive has said that the torch relay, which should be getting underway in just a few weeks' time, it'll travel all over this country, may well have to be scaled down.
And Jenny, what's the latest you're hearing from South Korea on the situation there?
Well, South Korea continues to ring alarm bells, because just look at the timescale. In just over a week, they've gone from having a few dozen cases to now something in excess of 1,700. Many of those cases are linked to a religious sect, and the authorities are scrambling to try and test, they say, every single member of that organisation. But that's 200,000 people. They are continuing to test them. At the same time, after it emerged that a US soldier in the country, as well as a number of South Korean soldiers, have tested positive for the virus, the US and South Korean military decided to call off their annual joint military exercise. But a great deal of concern still over the situation there, which doesn't seem to be getting any better. And they're watching across the water here in Japan with considerable alarm. You look at China, the World Health Organization has said that while still people are being infected, they're still dying. Overall, the picture there does seem to be improving. That is most certainly not the case for other countries like South Korea, perhaps even Japan in the region.
Jenny, thanks for bringing us the picture from right across Asia. Well, Saudi Arabia has stopped foreign pilgrims from entering the country for religious visits, including to the two holiest sites in Islam, Mecca and Medina. Millions of people go to the country throughout the year, with a big surge in visitors, which happens during the Hajj in July. It is unclear if this pilgrimage will be affected. The country has also barred visitors from countries where the new coronavirus has spread. And in Iraq, we're hearing a sixth person has caught coronavirus after travelling from Iran. Baghdad today ordering the closure of public gathering places. That means cinemas, coffee shops, clubs. They've all been shut until the 7th of March to try to control the spread. So a real lockdown happening in Iraq at the moment. Let's take you live now to our correspondent Samir Hashmi, who joins us from Dubai. So firstly, has there been any reaction to the Saudi authorities telling foreign pilgrims they can't come?
Well, it's come as a bit of a surprise, not a huge one, Lucy, considering that the virus has spread very widely in the last 3 or 4 days. Now, it's only last week that Iran first reported a few cases of the coronavirus, and then over the last 4 days we saw Kuwait, Oman, Bahrain, Iraq, reporting confirmed cases, and that number has gone up substantially. Now, all of them are linked. All these cases, the new cases that have emerged in Oman, Bahrain, Kuwait, are linked to travelers who had gone to Iran for religious visits and were coming back to their countries. And that's the reason why the Saudi authorities didn't want to take a risk, considering that thousands of people every month travel to Makkah and Medina, the two holiest Muslim cities. And now with Ramadan, which is starting in the end of April, less than 2 months away, usually the number of people that travel to Saudi Arabia goes up. So clearly the authorities didn't want to take any chances. As of now, there are no cases of coronavirus reported by Saudi Arabia. So it's a precaution they're taking really before it leads to more complication on the ground.
Yeah, too soon to know, Samir, whether it will affect the Hajj in a few months' time. But what about Baghdad? Very strict restrictions being put in place there now with all of these closures. Are they being adhered to?
Well, yeah, Iraq is actually the latest country to announce these closures, Lucy. It was actually Bahrain, the first one to announce about 2 days ago. In fact, yesterday, it was Kuwait, the first one, who called off all their public celebrations on Tuesday, on National Day. And then you have Bahrain that has shut down all schools, universities across the country for 2 weeks. And now Iraq has taken a cue from these two countries and decided to virtually go in lockdown. It's been announced now. We still have to wait and see how strictly it's been enforced. But clearly, the governments over here in the Gulf are worried because there has been a rampant rise, and there are concerns that the number could go up. So clearly, they don't want to take any chances and they want to ensure that the numbers don't go up substantially. Here in Dubai, in fact, UAE was one of the first countries in the Gulf to report cases of the coronavirus in the last week of January, but the number has been around 13 officially. It hasn't gone up substantially, at least in Dubai and Abu Dhabi.
Samir, thanks for joining us from Dubai with that. Well, as Samir mentioned, many cases of COVID-19 infection in the Middle East have been traced back to people who have recently returned from Iran. Now, state media in Tehran say 26 people have died so far from the virus, with a total of 245 cases confirmed. And the country's health minister is now calling on people to avoid unnecessary trips. And let's update you on what is happening in Australia. The government there deciding to extend a travel ban on foreigners arriving from China by at least another week. This is the Prime Minister, Scott Morrison. He said there is every sign that the world is about to be gripped by a coronavirus pandemic. That view echoed a short while ago as well by the French President, Emmanuel Macron.
We are facing a crisis, an epidemic that is coming, and some countries are already much more affected. We have to organise ourselves differently at each stage and face it as best we can.
President Macron, France, of course, bordering Italy. Let's take you there, where the country's Civil Protection Agency has just said 2 more people have died, bringing the death toll there to 14. The number of cases jumping to 400. Several European countries have also announced new cases traced to Italy. Our correspondent Bethany Bell is in Milan for us. Bethany, just bring us right up to date with the latest picture across northern Italy.
Well, we've literally just heard that the number of cases has now risen above 500, as well as those 2 additional deaths that have been reported, 14 people now instead of the 12 that had been recorded up to now. We understand that among the new infections, at least 4 children have contracted the virus. Schools remain closed over much of northern Italy. Universities are shut. Here in Milan, major tourist areas are shut, but as you see behind me, people are still going about their work, and it's very interesting here. There is definitely a sense of insecurity, but it very much depends on who you speak to as to how people are evaluating this risk. Some people say, why didn't the government act sooner? Have they made mistakes in their early handling of this? And we have to be as careful as possible. Other people telling me this is an overreaction. Italy is still safe and open for business.
And what is the advice to people who want to travel at the moment, Bethany?
That varies very much from country to country. There are different different countries have done different things for their citizens. From one extreme, where a couple of countries have said that they'll put on planes to allow their citizens to go home, to other places which have said if you have been in an area, one of the hotspots, those groups of towns just south of Milan where the disease came out, if you've been there, that you need to self-isolate, or if you have been in this region in the north and you start getting symptoms, you should self-isolate. But in general, at the moment, the European Union is saying we're keeping the borders open, that this is a serious situation, but not a cause for panic.
Bethany, thanks for joining us with that from Milan. Lots to talk to with our medical correspondent Fergus Walsh, who has just joined me now in the studio. Fergus, can we start first with this news from China and Japan, one case in Japan, of someone who has left hospital, they've had the coronavirus, seemingly well, but then been tested positive again. What do we know about that?
So what we know is that no one is sure why this is, because this virus has only been around in human terms, spreading from person to person for a couple of months. So there's a vast amount we don't know about it. There are viruses that go into the body, then can be latent and reappear again. It's probably more likely that the person never got rid of it. Now, you can get reinfected by diseases if your immune system drops and you lose your immunity, or the virus changes sufficiently that it can infect you again. It doesn't look like the virus is changing very much at the moment. So it's uncertain whether these cases, certainly the woman in Japan, whether she was actually ever really free of the disease. And in the Chinese cases, they were doing anal swabs for their follow-up tests, and that's how they then said all these people were positive again. So lots of uncertainty, people scratching their heads, coming up with all sorts of theories about why this might be the case.
Are there different ways to test people for the virus?
Yeah, so the standard way of testing is to take nose and throat swabs, and if people are really ill, then you can take samples from their lung tissue. And they give, if it's done properly, they are pretty accurate, and you can get a genetic readout of not only the virus, but exactly you can trace where it's come from. So you can see whether from the genetic code of that test, whether it's similar to what's happening in China or another country. But when you're doing a simple test like taking a nose and throat swab, it may miss the virus if it's not done properly. So the tests are not perfect.
And do you get the result back quite quickly?
It takes normally a day or two for that result to come back, depending on the system and how many thousands of tests that labs are doing. But in the UK, it's a kind of 48-hour turnaround, or it can be done more quickly than that.
How widely is the information being shared? How much are governments and health authorities working together?
Well, I think China, although it covered up very badly at the beginning, subsequently, once it woke up to the gravity of this infection, it then shared information very quickly. It shared the genetic code of the virus, and it did that internationally, and that's allowed teams all over the world to start working on vaccines, although we can forget about those being ready for a long time yet in any numbers. So no, there's a lot of information sharing that's going on.
So finally, Fergus, what are global health authorities most worried about today?
They're worried about Iran and Italy and South Korea, and the fact that in those countries especially, you can probably put a multiple of 100 to 1,000 per reported case, which is not a criticism of those countries necessarily, but especially in Iran. If you look at the number of deaths and the number of reported cases, there must be multiples of hundreds or thousands of cases that haven't been reported. And then they're worried about that spreading globally, and that China now has fewer daily cases than the rest of the world combined. So this is now very much a global problem, not just something that's related to China.
Fergus, thank you so much for that. Good to have you with us.